I'm finally doing this. Hello everyone, my name is Whitney and I'm a dental hygienist. I've been a dental hygienist for about 5 years now and I've been making videos here on YouTube for about the same amount of time. If you're new here, welcome. If you've been here before, welcome back. Let's finally talk about the pros and the cons of working as a dental hygienist. I keep emphasizing the finally because this has been a highly requested video that I've been avoiding. I don't like ever putting any kind of negative things out there, you know, the con part of this video, the cons. So please keep that in mind while watching this video. I do not mean to be negative while talking about the cons of this career, because every job has pros and cons. I just don't want to see a bunch of people bashing the field of dental hygiene in the comments below because the career didn't happen to align with their personal life, you know? Not everyone is going to love the same things. That's what makes us human. And having said that, for those of us who do love the job of being a dental hygienist, I just want to make sure that everyone knows it's okay to admit that there may be parts of the job that you aren't 100% loving. There's always pros and cons to everything. So here we go. Let's start with the pros because positive equals life. The pros of dental hygiene. Pro: helping people every day. Not every job gets to say that. We truly are helping keep patients' mouths healthy and improving their health and maintaining their health, which affects their overall health. Pro: good pay. In general, the average hourly pay is pretty stable. Certain areas and locations, depending on where you live, are better than others, but regardless, we really worked hard in school to be offered a pretty solid hourly pay. Pro: freedom. In many offices, you kind of might feel freedom to the job of clocking in, doing your thing, and clocking out. I'm not saying you aren't part of a dental team because you very much are, but what I mean is most hygienists won't have their boss like breathing over their shoulder all day. You usually only see your boss when you are doing exams or you need to talk about treatment planning. And if you have your own operatory, it's kind of cool to have your own space and to do your work freely. Pro: you literally do not bring your work home. Tried to say that like period between each word. You literally don't bring your work home. And you cannot bring your work home, right? I know so many people in different industries that bring their laptops home to finish up their work in the evenings. But for us, we are definitely not bringing our patients home with us. Pro: you have the choice to work in a big corporate office or a small private practice office. Both of these are completely different vibes, so that's something cool to be aware of. If you don't love one type of office, you have the opportunity to try another type of office. Pro: another pro is that dental hygiene is a super nice job for temp work. So if you don't plan to commit to one office, there are multiple temp agencies out there where you can cover maternity leaves and other random days at different offices in your area. Pro: on that same note, dental hygiene offers part-time, and it's super normal to be a part-time hygienist. This makes it convenient if you're a parent who needs that flexibility, or if you're someone who prefers to work at 2 different offices to keep things fresh, or maybe you have another part-time job that you love and you can't choose between your dental hygiene career and your non-dental hygiene career. You can do both. It's super flexible and convenient to have this normalized part-time option. Pro: dental hygiene has multiple degree options and higher education opportunities. The bachelor's degree, for example, in dental hygiene is a great choice if you're looking into different career options within the field of dentistry, such as sales, research, education, and more. There is also a master's degree in dental hygiene as well. I actually have a video all about the different degrees and career options for dental hygienists, which I will link that video in the bottom bar below if you want to learn more. Now let's talk about the cons of dental hygiene. Con: although we just said part-time can be considered a pro, it can also be considered a con if you're looking for a job with full-time vacation and benefits and you can't find it. Dental hygiene full-time salary jobs do exist, but sometimes depending on the area and location that you live in, you just really have to find the right one because lots of times they are offered through corporate offices. So if you're someone not looking for a corporate job, it might be a little harder to find in private practice. I know someone is probably going to comment that they have the perfect private practice full-time job with benefits, which is great. Again, I'm not saying it's impossible to find. I'm just saying that they are usually less widely available than the part-time dental hygiene jobs. Con: exposure to hazards. We all know that blood and saliva can contain disease-causing germs. But if you follow proper infection control and trust the office you're working in, this should not be a con, but more of a precaution. Con: it's hard to call off work. Again, not in every case, but in a lot of cases, it's not easy to just call in sick the morning of, or even the night before. Can you call in? Of course, but it's stressful because you have a whole schedule of patients waiting for you. And what are they supposed to do with your schedule if they can't find a temp? Call everyone to reschedule, but for when will you feel better? Generally, dental offices are jam-packed and it's not easy to schedule a full day of patients. So not only is it super stressful if you want to take a day off, off and you need to find someone to cover you in advance. But it's super, super, super stressful if you're sick and you have to call your office and tell them that you can't come in. Maybe this isn't a con for some people because maybe some people don't care, but I just care so much and I'm always stressed about that. Con. This one kind of goes along with saying that you cannot bring your work home that we said in our pros, but in this sense, a clinical hygienist cannot work from home. That's not an option. I thought a lot about this during the shutdown in April 2020. Everyone's working from home and here we are trying to invent something to virtually clean people's teeth. It's just not a thing yet. Con. Monotony. I've heard a lot of dental assistants saying they would never go into dental hygiene because it's monotonous. It's the same thing over and over. However, I beg to disagree, or maybe I'm just someone who enjoys monotony. But I truly don't feel like I'm repeating the same thing over and over because one, there are different types of cleanings and job requirements that we do throughout the day, and two, even within the same adult prophy cleaning, every mouth is different. You will always find something new and something that surprises you about someone's mouth or someone's teeth. And I'm constantly learning about all the extra things we can do as hygienists, such as screening for sleep apnea, discussing nutrition, smoking cessation, and keeping up with all the latest advances in technology and research. So I love it. But again, everyone is different. I've heard it's monotonous according to some people, but I just don't feel it. Con. Body breakdown. Sometimes hygienists will have back problems, neck problems, hand problems, wrist problems, body problems. So it's super important to practice good ergonomics while you practice in office and take care of your body outside of work to avoid these issues. But if breakdown of your body is unavoidable, this is a big con for clinical hygienists. Con. State licensure transfers. So once you become licensed nationally, you have to become licensed in the state in which you plan to work. So if you plan to move later on and want to work in a state that you weren't originally licensed in, it's just not always the easiest process. I've actually heard it's quite a headache. You have to sometimes retake your boards in certain states and get re-licensed. Again, each state is different, but it's definitely something to keep in the back of your mind if you ever plan to move to a different state. So that's my video, pros and cons of working as a dental hygienist. I'm sure there are many more I didn't cover, so feel free to comment those in the bottom bar if you think of anything, but please be educational about the pros and cons and don't be bashing the career. If you want more teeth talk, you can visit my website teethtalkgirl.com, where there is a search bar where you can search for a specific dental topic if you want to find an article or video that goes along with it. I make new videos every Tuesday and Thursday, so until next time, peace, love, and teeth.